So we are discussing today auscultation of the heart. Okay, so you are first year physiotherapy students, right? At Abbasin University, and here's Islamabad International Hospital Research Center. You're coming for the internship here as well. So we are today discussing the auscultation of the heart, right? As being physiotherapists, you need to know what auscultation means, and when we auscultate the patient, what we are looking for, what we are hearing, right? So that's very important, that for auscultation of heart, why are we doing the auscultation of heart? And that's one of your modules as well, to understand why auscultation of the heart is done, especially for the physiotherapist. As a doctor, we know that you have to know the different diseases as well. So for you guys, especially you being the first year of physiotherapy, what we are discussing today is auscultation of the heart would be that I should tell you what you're looking for and what is the science behind it, right? So when you're doing the auscultation, what you're hearing and what is the science behind it. And that's very important today, that you know the basics of auscultation, right? So as you know, this is our heart. This is the model of the heart, right? And how many chambers we have in the heart? 4 chambers. Very good. And these chambers are called? So right atrium, left atrium, right ventricle, and left ventricle. So if I make it like this, make it easier for you. So this is right atrium. This is right, left. That's how it is. And where is the heart situated? Here, somewhere here, like this. Okay, so this is called surface anatomy. If somebody asks you, draw a diagram of your heart on my skin, then if I do like this, this is your heart like this, right? This is called surface anatomy. That you can you make a sketch of the heart or anything on your heart by doing on the surface as well. This is called surface anatomy. So if you look at the surface, and this is the heart model, and that's how it is there, right? It's very important to understand, because when you're auscultating, you need to know where you're putting your stethoscope, right? And unless you know the anatomy, you will not be able to know where to put the stethoscope. Understand? And it's very important. That's why I say we need to know the basics of auscultation, what we are looking for, and that's we need to understand this thing, right? So this is right atrium, which opens into right ventricle, left atrium, and left ventricle. And you know, the whole of the blood from the veins come to right atrium. Then it goes to right ventricle, right? And then from there it goes to where? Lungs. Because this blood is without oxygen, or has got less oxygen. I won't say without oxygen, less oxygen, more carbon dioxide. You send it to the lungs. Lungs do what? They take the carbon dioxide out, put the oxygen in, and push it back to left atrium. Left atrium blood goes to where? Left ventricle. From here it goes to aorta. Aorta is the biggest artery in the body. So if somebody asks you a question in MCQ and a Viva, which is the biggest artery in the body, you will say what? Aorta. So aorta is the biggest artery in the body, and it goes from where? Left ventricle. Now you might have seen these things. What are these things? Do you know what are these things? I put these walls. So these are basically walls. And what are these walls for? What is the significance? What is the importance of these walls? Do you know that? What is the importance of why the nature has put these things there? Why this gate is here? This is room, and you've got a gate here. You can control. Anybody can come in, Anyone can go in, go out. So that is, a wall is basically a gate. And they are like this. They're not like this straight. They're like this, a V shape. They allow the blood to come this way. But when the blood goes back, they close. Blood comes this way, fine. When the blood goes, they close. So basically, these walls allow the one way of the unidirectional blood flow. The unidirectional blood flow is because of these walls or the gates, right? So this gate is between the right atrium and right ventricle, this gate or this wall. And this wall is between left atrium and left wall. This gate or this wall between right ventricle and pulmonary artery. This gate or this wall is between left ventricle and, so this is very important that you know these gates and these walls, because in auscultation, when you hear the sound, it is the closure of these walls. It is the closure of these walls. When you hear the heart sounds, you're hearing the sounds of these valve closure. And anybody can ask you anywhere in the world that when you are auscultating, what are you auscultating? What you're looking for? The heart sounds. Some people are loop dub. First heart sound and second heart sound. These heart sounds are because of the closure of these walls or the gates. And you know where these gates are. Now another thing you might have heard, if you have, do you know what is systole and diastole? Systole and diastole. Do you know? What does diastole mean and what is systole means? Systole means when your heart contracts, pushes the blood out to the body. This is called systole, the contraction. Then your heart receives the blood back. Relaxation. It's called diastole. Systole is the contraction of the heart, pushing the blood from the heart to the rest of the body. Relaxation, diastole, heart gets the blood back. Okay, this is how it works. So somebody can ask you, are you listening for systole or diastole, or are you listening for the closure of the walls? What will you tell them? When I'm looking at heart sound, these heart sounds are produced by systole, diastole, or they are produced by closure of the walls. Closure of the walls. Closure of the walls produces these sounds, and that's why you hear them, right? So, and there are names to these walls as well. If anybody knows the names of these walls, do you know the names of these walls? Where is tricuspid wall? Where is it? There's a name given to all the walls. Like when you go to a building, a Abbasin building, and there are gate 1, gate 2, gate 3, gate 4, gate 5. So if somebody says, where can I meet you? You say to them, I'll meet you at gate 5. So everybody knows what we are talking about. Gate 5 is there in the south. Fine. So do you know the names of these walls? No problem. So the wall between right atrium and the right ventricle is called tricuspid. Excellent. What is called? Tricuspid. And the one between left atrium and left ventricle is called mitral. Mitral wall. The wall between the right ventricle and pulmonary is called pulmonary wall. Pulmonary wall. You know what pulmonary means? Pulmonary means related to the lung. Where are you going? Have you got a cough problem? Somebody said, I've got a cough problem. Who should I see? You should go and see a pulmonologist. The pulmonologist means a specialist who deal with lungs. So pulmonary wall means related to the lung. So this wall is called pulmonary wall. And what is this wall called? Aortic wall. Excellent. So now we know what is auscultation, and we know the basic anatomy. And the basic anatomy is that there are 4 walls and these are gates. And these gates and these walls allow the unidirectional flow of blood. The unidirectional flow of blood is because of these walls, because the way they are. Okay, when the blood goes through them, it allows one direction. When it goes back, it closes. So unidirectional flow of blood is because of the anatomy, the structure of the nature has made, right? And we've got four walls: tricuspid, between right atrium and right ventricle, and then mitral between left atrium and left ventricle, pulmonary, which is between right ventricle and the pulmonary artery, and the left ventricle which is between the aorta and the left ventricle. And the biggest artery of the body is aorta. Excellent. Now we coming next, how these sounds are produced. And we said these sounds are produced when these walls close. And how many sounds we usually hear? There's so many, but at least the most important one called lub dub. S1, S2, lub dub. Now, where to find these sounds? Where to find the pulmonary tricuspid? Where to find the mitral? Where to find the pulmonary? And where to find aorta? If somebody asks you this question, then there is a mnemonic. Have you heard of this mnemonic? A, P, T, M. A is for pulmonary, tricuspid. You need to know these things as auscultation. And if you know these things, I can tell you that you know more than a final year medical student. Because nobody teaches like this. So it's very important for you guys that if you know, how would you know the abnormal? How would you know the abnormal? If you know the normal. If you know the normal, and when you see something abnormal going, then you find this is not normal. So it's very important that you practice and you find and you put this thing in your ears, in your brain, and kind of make your brain used to it, what is normal. Because when you are doing physiotherapy, especially for doing rehabilitation, a stroke patient, a cardiac rehabilitation patient, a pulmonary rehabilitation patient, then you'll be able, if you say, doctor, oh, my heart is beating fast, my heart is beating fast, then you can put your stethoscope on it and you find out this is normal or abnormal. And if it's abnormal, then you can tell your doctor colleague something's happening, this patient needs ECG, immediate attention. So, but you need to know what is normal. So that's very important for you, right? So what we conclude today, what we learned, how to auscultate the heart, right? We learned the mnemonic, APTM. We know what is lub, what is dub, S1, S2. S1 is when the heart, these two walls are closing. S2 and these two hearts walls are closing, right? We know what is normal, and it's important to know what is normal so that we can differentiate from abnormal. Excellent, excellent.